Hi, Rintana. How are you doing today?
Fine, how are you?
I'm good, thanks. My name's Melissa,
I'm Zoe.
Hi.
and we're here to just teach you a little bit about diabetes.
Oh, that's good. I was just reading about it. I need more explanation. That's nice.
Oh, wow. Well, that's awesome. You seem really motivated to learn.
Oh, yes.
Well, that's what we like to hear. How would you feel that your knowledge is right now about diabetes?
I say 80%.
So you're pretty confident in it? Good. Well, we're here to make it 100%.
Okay.
Okay? So I have 3 resources right here for you that are going to be able to go home with you, and they'll be there for when you want to refer to something, and they will just give you some key pointers and things you need to remember. I understand that English is your second language, so if you're having difficulty reading these because unfortunately they only come in English, we can get a translator here or find other methods to help you remember them. Okay? So this is a Canadian food guide, and in this book here it just talks more about how to manage your diet and exercise. Okay? And this is also another pamphlet on how to manage your diabetes, and in it, it gives a step-by-step procedure of how to give the insulin, like Zoe's going to go over in a few minutes. So just kind of reinforce the learning.
All right, so this is your insulin needle. Alcohol swabs, insulin R and insulin N. So when you're going to administer to yourself, just look at the units on the side, and depending what your doctor says you need or what your glucose says you need in order, or I guess in terms of how much insulin. So you take the cap off, you inject, say you need 10 units of N, you'll inject 10 units of air into the N, pull it out, inject say 5 units of air into the R, and then draw up 5 units of R insulin, take it out, draw up 10 units of the N insulin, recap it, and then use the alcohol swabs and just clean a spot on the back of your arm here or on your stomach. And then you can uncap it, and don't jab it in too fast or too slow. Just pinch the skin like that, and then just a good little quick motion, and then jab it in and inject it. Just make sure there's no air bubbles before you inject it. And when you're done, cap it and put it into the sharps bin.
Okay.
Do you feel confident in trying this now?
Yeah, that doesn't look that hard.
It's not, especially when you get the hang of it, which we'll let you try.
Okay. So this is the R, this is the N, and this is my needle.
5 minutes later.
Where do I go? Oh. Yeah, that's easy.
Yeah, you did a great job. I think you've really got the hang of it.
Oh, thank you.
Do you feel confident in doing it?
I think so, yes. And this will help me, like, the steps will help me.
Okay, so we're just going to let this sink in, and before you leave, we're going to have you show it to us one more time,
Okay.
just to reinforce your learning.
Okay.
Do you have any questions before we go?
I think I have everything I need. I'll think about it and I'll let you know.
Okay, sounds good.
Thank you very much, nurse.
We'll see you in a little bit.
See you later. Thank you.